Natalie. I'm going to be your nurse today. I understand you're here for a well visit, checking out your skin and your head and your face and your neck. Is that correct?
That's correct.
All right. Let's start with something nice and easy. Can you tell me your name and your birthday?
Ann Madison Pride, and my birthday is June 30th, 1962.
Perfect. All right. So we're going to start with your skin, just because that's a nice, easy place to start. Biggest organ we got. Let's just get it out of the way, right? All right. So if you'll uncross your legs for me. I'm going to just pull up both your pant legs. I apologize, my hands are cold. So I'm going to walk you through every step of what I'm doing kind of as I'm going so that you know what I'm doing and you're not wondering why in the world is she touching me there, and you have an idea. If you have any questions, feel free to stop me as we're going, and if anything makes you uncomfortable, just let me know and we can step back and reevaluate, okay?
Okay.
All right. So what I'm doing right now, I'm looking at your arms and your legs. I'm looking at the color, and the color is great. It's very appropriate for your race. I'm looking at hair distribution, which looks completely even on your arms and your legs. I'm noticing your temperature. It's very warm, but you're not feverish, nor are you cold. I'm sorry, I know it tickles a little and my hands are very cold.
Mm-hmm.
So you do have very soft skin, which is also good. I'm looking for any adhesions or lesions noted on your arms or your legs, and I'm not seeing any. Don't have any signs of edema, no varicose veins. Everything there is looking really good. So we're off to a really good start.
Okay.
I'm going to move on to your nails, so if you'll let me see your hands for a moment. Thank you. While I'm looking at your hands, I'm also noticing that your skin is very hydrated. It's nice and moist, but it's not like weeping fluid, so it's a great balance. Your nails look great. Checking your cap refill here, and it's less than 2 seconds, which is right where we want it to be. It's great. Not noticing any clubbing or any abnormalities noticed to your nails, no fungi. Your nails are nice and thick, and they're adhering to the nail bed just like we want them to. So everything there looks perfect.
Good.
All right, so let's move on to your head and your face. We're kind of going to start from the top and just like work our way down, okay? And I apologize, since this isn't an actual clinical setting, I'm going to have to kneel on this chair. I would not do this in real life, sorry. All right, so what we're going to do here, I'm going to take a look at your scalp first, okay? So you're going to feel my hands touch you. And what I'm doing as I'm going is I'm kind of palpating your head. I'm feeling your skull, and I'm looking at your head for shape and symmetry and size, all of which looks appropriate for your age right now, which is great. I'm looking at your scalp, and everything looks very healthy. You look like you're enjoying this a little bit.
Yes, it feels good.
Everything looks really healthy. It's not overly oily or overly flaky or scaly. You don't have any dandruff. Again, I don't see any lesions or adhesions. I'm not feeling any bumps or dents that aren't supposed to be there anywhere on your head, so that's great. I'm also looking again at your hair distribution, which seems to be evenly distributed over your head. Your hair feels healthy for the most part. You can tell you colored it a little bit and done a little damage there, but for the most part, very healthy hair, so that's a good thing. So let's move on. We're going to move on down to your face now. So what I'm going to do, I'm just going to feel your face again. I apologize for my cold hands. So what I'm going to do is just kind of feel around again, looking for any dents or bumps or bruises that aren't supposed to be there. I'm going to feel your sinuses. Any pain when I press here?
No.
Good, okay. So feeling around here, no pain, no bumps or anything that's not supposed to be there. While we're here, we're going to check your TMJ. So do me a favor, open your jaw really big, really, really wide. Good, good, good. Close your mouth. Open again really wide. Close your mouth again. Perfect. So what we're checking there is your TMJ, and we're looking for any clicking or any what we would call crepitus, which I'm sure you're familiar with as a nurse, and you don't have any right now, so that's a great sign. While we're here, we're going to start assessing our cranial nerves. Now, as we're going, we're going to hit all 12 of them. I'll try to keep you apprised of what they are as we're going. Right now, we're going to look at number 5, okay? That's your trigeminal. So I want you to just, basically it's looking at your jaw and your chewing effect. So just act like you're chewing a piece of food. Perfect. So your jaw's good and strong. You can push against my hand. Can you wiggle it back and forth like this? Perfect. So everything there seems to be working appropriately.
Good.
All right, we're going to move on to nerve 7, which is your facial nerve, and it helps you. Can you do a really big smile for me? And frown really sad. Puff out your cheeks like a monkey. Show me your teeth. All right, and purse your lips at me. Perfect. So everything there seems to be working really well, okay? So we're off to a good start. All right, we're going to move on to your eye exam. Now, there's a lot of parts to this one. Usually when people think about an eye exam, the first thing they think of is we're talking about your cranial nerve number 2 is your optic nerve. And when people think about an eye exam, they think about those charts that you see at the eye doctor. You see that Snellen chart that you see is the one that has all the letters on it that you look at. And they say, oh, try to read the smallest writing you can. And we'll tell you, you have 20/20 vision. And that's your far vision. And then we'll show you another one that's the Reinbaum chart that has like the 95 on it and the rest of the numbers and letters. And we'll say again, read these numbers and letters and read me the smallest ones you can. And those are going to be your near vision. And we'll tell you if you need correction or not. We're not going to worry with all of that today. Okay? The only thing I'm going to check right now is I am going to check your peripheral vision. So what I want you to do, I apologize, I'm going to have to straddle your legs here. Again, for this setting, not clinical. What I want you to do is tell me when you can see my fingers.
I can see them
Perfect. And again.
now.
All right, and one more time.
Now.
Perfect. All right. So we're going to move on and we're going to assess some more of your ocular muscles. So the other cranial nerves revolving around your eyes, we're going to look at 3, which is your olfactory nerve. We're going to look at 4, which is your trochlear nerve, and 5, which, or I'm not, sorry, not 5, 6. I don't know who numbered these, but they're in a very strange order. We're going to look at 6, which is your, blanking on the name of it right now, but give me a second, it'll come back to me. It's also involving your eyes, though, and the way that you look. And basically, all of these nerves work together for your eyes to be able to move in all the different directions, up and down, and horizontal, and straight out vertical, and everything else. So, what I want you to do is I want you to look at my finger right here, and I want you to just follow it with your eyes, just your eyes. Perfect. And again. Great. So those are all great. Those are the cardinal movements of your eyes, and they're all working appropriately. So it looks like all those nerves are kind of working together, and they're doing the right things. So what we're going to do here, I'm going to grab a little tool here. All right. And we're just going to take a look at your eyes in a couple of different ways. Now, first what I'm going to do, have you just look straight ahead at me, and I'm just going to shine this at your eyes. And you can see they had that great effect. It had that nice twinkle to your eyes, which is exactly what it's supposed to do. It's a good thing. What I want you to do now is I'm going to have you turn off the light behind you. Alright, so it's nice and dark.
Okay.
And what I'm going to do, I'm going to shine this light in your eyes again. And your eyes got that nice red that we notice occasionally when you're taking pictures. You can turn the light back on now. Thank you very much. Perfect, thank you. So it got that nice red color that we notice, and that's what it's supposed to do. That's a very good thing. Okay, so we're going to keep up with your eye assessment. I'm going to take a look at something called accommodation. So what I'm going to do, I'm going to shine this light in your eyes twice in each eye, okay? And what I'm watching is your pupils and how they react. I want both pupils to react to this light every time, and they did that time. And once more. Perfect. Eyes did exactly what they were supposed to do. So you're doing really good there. Everything's going the way that it's supposed to.
Good.
All right. I feel like now's a good time to show you that I don't have study notes and whatnot. So I'll kind of show you the room. You can see. Please don't judge me for how dirty it is. But there's no notes and things. This is the other half of my room. Okay. And that's my mom. Isn't she pretty? Okay. So continuing with our exam, we're going to keep looking at some things with your eyes. So basically what I'm looking at right now, I'm looking at your eyebrows and your eyelashes. Everything seems evenly distributed, which is a good sign. I'm looking at the shape of your eyes, and it's that good almond shape. They're not too close together or too far apart. Your lids aren't sagging like we would expect with some people, but it's a very good thing that they're not. Everything looks good. Your sclera is nice and white. Your irises have that lovely shade of blue. Your pupils are nice and black.
Thanks.
I'm also looking at your conjunctiva, which is this pink part right in here, and it looks great. It doesn't have that, I'm just going to pull it down just a touch. It doesn't have that white anemic look. It looks very healthy, which is good. Excuse me. While I'm here, I'm going to go ahead and push right here on this sac, and it's perfect. It looks really good. No pain or anything when I'm pushing on your face?
No.
Perfect. I'm looking at the inner inside of your eye, and again, it looks great. So far everything is looking really healthy. I'm going to turn my light back on here again. And what I'm doing now, I'm looking at the globes of your eyes, and everything there seems to be the appropriate shape. Now I'm going to turn this on, and I'm going to look through it, and what I'm looking for is I'm looking at all the vasculature in your eyes, and it all looks great. It's the nice shade of pink that we expect it to be, but not red like it's irritated or inflamed. Excuse me. Mm-hmm. Look in this eye, and again, same thing. And we're able to see all the big important things. So everything there looks really good. All right. I think that's about all we need to cover on your eye exam, so we can move on to something different. So we're going to start with your ears next. Let me just grab the piece for this. All right. So what I'm doing before I start, I'm just taking a look at the outside of your ear. Everything looks really good. Just looking at the mastoid and the auricle. And what I'm going to do is I'm just going to look inside, okay? Everything looks great. Canal looks good. Tympanic membrane looks good. Even on down into the smaller things like the meatus. So everything looks great there. What I'm going to do, I'm going to whisper in your ear, and I need you to tell me if you can hear me.
Yes, I can.
Okay. So we're going to move to your other side. I know it seems a little silly. We're going to move to your other side and do the exact same thing.
And then I'm going to move over.
Nope, you're perfectly fine. Thank you, though. All right, and again, everything looks good. No lesions or builds up of any kind. No big amounts of cerumen or any foreign objects in there or anything we'd be looking for.
Right.
So everything there looks really good.
Good.
So we're going to check something with your hearing now. So this is my tuning fork here. And what I'm going to do, I'm going to place this against your forehead once I get it vibrating. And I want you to tell me where you hear the buzzing noise. Up there? Okay. Alright. Is this louder here? Or... Oh, excuse me. Didn't mean to throw things at you. Or here.
The first one.
Okay. How about on this side? Here. Or here.
First one.
Okay. That's a good sign. All right. So we're done messing with those. And we're going to move on to your nose. Basically what I'm looking at with your nose, like everything else, we're looking for symmetry, which it seems nice and symmetrical on both sides. I'm looking at the septum here, which seems good and not deviated. All your membranes on the inside look nice and healthy. I know it's kind of awkward having somebody look up your nose, but everything looks good. I'm going to check the patency of both nostrils now. And I know this might make you a little uncomfortable, so basically I'm just going to block off one side of your nose. Just stay with me. I'm going to block off one side of your nose. I want you to take a big, deep breath in through your nose. Perfect. We're going to do it again. You ready? Do it again. Great. So everything there is working really, really well. All right, now I want you to close your eyes. And I need you to tell me if you smell anything.
Oh, yes.
What do you smell?
It's like a lotion.
Close enough. Yep, that is my pineapple lotion. All right, but you can smell it, so that's good. You can open your eyes again. Thank you. All right, so now that we've dealt with the mouth, or the nose, I'm sorry, we're going to move on to the mouth. So as we've been talking throughout this assessment, I've been looking at your mouth, and it seems to be working well. Sounds kind of funny, but your mouth is very symmetrical, which is a good thing. It's symmetrical at rest, and it's also symmetrical when you're talking, both of which are a good sign. We've been looking at your lips. Your lips seem healthy, and they're pink, and they're, again, appropriate for race. Your teeth seem to be mostly, if not all, present and healthy and taken care of. Your oral mucosa is nice and pink and moist, which is a good sign. What I'm going to have you do now, I'm going to grab a pair of gloves here, and I'm going to have to take a look inside your mouth, okay?
Okay.
So I'm going to look right here at your frenulum on the lower and upper parts, perfect, and I'm going to look at the glands. Good, everything looks good. Open. All right, I'm just going to touch the hard and soft palates in your mouth. Good, and they're exactly how they're supposed to be. Now stick your tongue out and say, ah.
Ah.
Ah, I need my light. It's very dark in there. All right, one more time. Perfect. So what I'm looking for there, I'm making sure that your uvula is A, doing its job, and B, that the soft palate of your mouth is raising up when your uvula is moving. And it is. Everything seems like it's working appropriately. Okay. So, all of those things that we just did, mostly that noise and things like that, those are also part of your cranial nerves. So those are part of cranial nerves 9 and 10, which are your glossopharyngeal nerve and your vagus nerve. Those are what control your ability to be able to swallow, as well as to talk and to gag. Now, since I've seen you be able to swallow and talk throughout this exam, I don't feel the need to gag you for this. I'm sure you'll appreciate that.
Thank you.
So we won't be doing that for right now, but that's what those nerves are. Okay? Now, the only other nerve I'm going to make you do something silly for is called your your hypoglossal nerve. So if you'll stick your tongue out at me. All right, and wiggle it around. Go. Very good. I don't do that just to make you look silly. I'm making sure that that hypoglossal nerve is working, which is cranial nerve number 12. Okay. All right, so we're going to move on to your neck now, okay? And this is the last part of our assessment, so you're almost done. All right. So what we're going to do, basically, again, I'm looking at your neck for symmetry, and again, it looks very symmetrical, all of what I expected to. I'm going to feel around the back of your neck, so you're going to feel my hands. And I'm just feeling the muscles around your spine. Again, you look like you're enjoying this a little bit.
So good, I could use
free
that.
massage. So I'm feeling the muscles around your spine, which all feel great. I don't feel any lumps or bumps or protrusions that aren't supposed to be there. We're going to check the range of motion in your neck. So if you'll sit up just a touch, what I'm going to have you do, lean your head all the way back. Perfect. Now touch your chin to your chest. Good. Put your ear to your shoulder and ear to the other shoulder. Great. Now we're going to take that part of the assessment and we're going to kind of kick it up a notch. Try to put your left ear against your shoulder now. Push against my hand. Very good. Now this side. Push against my hand. Perfect. Try to shrug your shoulders up against my hands. Very good. So those are, again, part of another cranial nerve. Those are part of your spinal accessory nerve. That's cranial nerve number 11. And you were able to do all of those things without resistance. So that's a very good sign.
Good.
And that's we always like when things go right, right?
Okay.
All right. So while you're talking, I'm looking at your trachea, which is right in the middle, right where I want it to be. And it's very symmetrical again. Symmetry is what we look for in everything. But it's looking really good right now.
Okay.
All right. One of the last things I'm going to feel for, I'm going to feel around for your lymph nodes. And you have quite a few of them in a few different areas. So I'm just going to feel around all of your lymph nodes. And I don't want to be able to feel these, and I'm not. So that's a very good thing. And I'll stop at your collarbones, I promise. All right, good. Didn't feel any of those, so that's a very good sign. All right. I'm looking at now your carotid arteries on both sides. Neither one of them are bulging out or distended, as we would say. So that's, again, a very good sign. I'm going to go ahead and palpate them, not at the same time because I don't want to make you pass out. And both are very easy to palpate, so that's a great sign. It means that they're working, but they're also not bounding. They're not working too hard, so it's a very good thing. I'm just going to take a listen with my stethoscope here. There we go. All right, keep looking up. Very good. And good. So I can hear the good whooshing of your blood as it's going, so that's a very good sign. The last thing that we're going to do is we're going to look at your thyroid. Okay, now let me talk you through what we're going to do because it's not the most comfortable part of the exam. It doesn't hurt, it's just, it's a little awkward. So what I'm going to do, I'm going to take your trachea, I'm going to feel it, I'm going to slide it over just a touch so that I can feel your thyroid, which is kind of hiding back there behind it. I promise it'll all go back in place when I'm done.
Good.
But we're going to feel your thyroid, and then once I've got my hand on it, I'm going to ask you to swallow. And you just swallow, and I'm going to feel if your thyroid moves. Okay? Then we'll put it back into place, give you just a minute, we'll do it one more time, and I just need to listen to it with my stethoscope, and then I'll quit trying to choke you. Sound like a plan?
That's good.